South Africa recording a second case of monkeypox. The health department saying that there is a high possibility of local transmission. And this is because the second reported case is of a 32-year-old man from Cape Town with no travel history. Let's bring in Deputy Health Minister Dr. Sibongiseni Dhlomo, who joins us this morning from Pretoria. Dr. Dhlomo, great to have you with us on the program to give us a sense of just exactly what this means when we say that there is a high possibility now of local transmission. What do we mean by that?
Good morning, ma'am, and good morning to your viewers. We mean that when we just take history from these two individuals affected, there is no history of having travels. It means they actually got it from either me and you, and probably me and you probably remain asymptomatic but have transmitted the disease. That is why there is a sort of an investigation of the close contacts of the persons, people who have been around this area, around these individuals, as to actually how they could have actually transmitted the disease from where. Because we now know that there is a prevalence of this monkeypox in the Northern Africa and the West Africa, but we haven't really. That is why, even though there are two cases in the country, we are reporting it as yet, because we haven't really had the big numbers of such in our country. The first time we have a monkeypox in South Africa.
Yeah. So as we go about contact tracing now, and I feel like South Africans will be familiar with that term given our experience with COVID-19. Do we think, Dr. Dhlomo, that even though we've got two confirmed cases of monkeypox in the country, that it may be much, much more?
It does much more, but not really to cause a panic. Obviously, for that person to symptomatically show that there's monkeypox, he probably got it from either me or you, and probably I remain asymptomatic, or I do already have it, but maybe have not presented myself to the laboratory, and my check has not taken place as yet. I could actually confirm, because it is an infectious disease that spreads by physical contact, that just these two cases mean that there's someone else out there we may not have picked up who do have a disease. But we would like to indicate that it is not really that it's a self-limiting in most cases. It is not as severe as where we come from. And I can tell you, ma'am, if I were to join you in the studio there with this monkeypox, the whole day long, I don't hug or touch you, you may still go home without this monkeypox, because it does not spread like what we have been used to of COVID-19 in one room. I cough and sneeze, and therefore the virus spreads into. This virus has to move from you to me through the contact by physical touching.
Yeah, yeah. And Dr. Dhlomo, I'm glad you're clarifying it that way, because you're now saying it spreads by physical contact, right? But the way that even the health minister has described transmission of monkeypox in the past has been incredibly problematic. He's emphasized that it's between men who have sex with men. We know the dangers of describing monkeypox and its transmission in that way, given what members of the LGBTIQ+ community faces daily insofar as threats to their lives. We don't need the added stigma, do we? Is the health department then, given that, also to blame for perhaps people not coming forward if indeed they do have the symptoms because of that stigmatization?
Look, I don't think, sometimes it's symptomatic. I will see some lesions. I mean, me and you, we never experienced smallpox. Smallpox was probably with our parents and grandparents. These are just mainly skin lesions that you can't hide. Once you have it, we would probably think that should probably not discourage. But I would like to look at it as a disease that could even affect me. I shake someone on the street, I shake a friend of mine in a close contact. I don't know the sexuality of that person. I then could get this monkeypox. So I probably would want us to concentrate more, and maybe, yes, maybe discourage to use that as an issue to say, where do you get it from? Mainly it is a human spread by touching and hugging and just getting close contacts with the person who has got it. And I would still urge our South Africans to come forward if they do have. Of course, it's a self-limiting disease. It really does not cause as much of a severe illness as where we come from. To date, we still have about more than 100 people every day in South Africa dying of TB. Then you would have an issue with monkeypox. We're just making it an issue because it's a new disease that we have not been aware. Please be aware there's a monkeypox out there. It's a self-limiting disease. It does not cause so much of an illness. It's an itchy, scratching on lesions. Please be careful and let's make sure you don't touch. Of course, emphasizing on personal hygiene, washing, cleaning ourselves before you touch and hug any other person.
Yeah. So perhaps as we discuss, you know, if indeed I do have symptoms and I fear that I might have monkeypox, what steps do I then take, Dr. Dhlomo, insofar as isolating, etc., is concerned?
Yes, you would also, not very far from what you do, if you were to pick up a leaky one at home with the chicken pox, probably isolate, keep at home, close contacts, not much hugging and kissing, and so the same we will do. We will probably isolate ourselves, make sure I wash, clean my hands. I avoid when I have lesions and blisters on my hands and body to hug and also touch. I will also, if incidental I've done that, go and wash my hands and clean up and make sure that this virus does not spread on me. But I'll also seek medical support in terms of, because this is like an itchy, scratchy lesions, get something that will calm down the itchiness and the scratching. If there are other things related to the muscle pain, the body pains, then get something related to that, fever and headaches. Otherwise, it is usually self-limiting. Within a week or so, it will be gone.
Dr. Dhlomo, the U.S. announcing plans to release 56,000 doses of a vaccine. We understand that the vaccine is, in fact, for smallpox, if I understand that correctly. 306 of these monkeypox cases detected in the U.S. Would we be interested in getting our hands on doses of that vaccine here in South Africa?
We'll probably be advised by our scientists, but I will still be more keen to see me and you getting and actually getting the booster and the vaccine for COVID-19, which is much more serious than this one. The countries that are probably already having this monkeypox much more than us, yes, they could still look into that much more. We have other pressures that we can look into. I will not prioritize vaccination on monkeypox than I would do for COVID-19 and also for TB and any others of those that are really prevalent and much more stronger in our communities than monkeypox. We're just reporting monkeypox because it is there and it is happening in the world. Yes, with time, you might find that we are paying more attention to it than we do, but I would still think that first things first, those that are worrying us much more, those are the ones we need to concentrate on them for now. We're just reporting monkeypox, but it's already there, but not really having a heavy burden on us as yet.
Certainly. Dr. Sibongiseni Dhlomo, let me thank you for your time this morning. The Deputy Health Minister keeping us up to speed on the second case of monkeypox confirmed here in South Africa. Thanks for joining us this morning.